Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Ozzy and Dr. Arazu Nasiri show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
Hi, welcome back to another episode of the Smile Sisters.
Yes, today we're going to talk about something that a lot of people are interested in, and that is, why do your veneers fail? Why do they chip or break or fall off?
Yes, so a huge problem, right? And veneers have gotten such a bad sort of reputation. Sometimes people will come in and say, I don't want veneers. My friend had them done and they fell off. I had a patient yesterday. She goes, my friend went to, I don't know where, flew somewhere, got them done. 2 of them fell off on the plane ride home.
Oh, no way. Oh my gosh.
So has nothing to do with the air pressure on the plane, okay?
That's
Just letting
true.
you know.
People blame everything on that. It's like, okay, like that's not going to make your teeth fall out, okay? It's not that high.
So they get a bad reputation, and she was like, I'm just very worried. I don't want to have that happen to me. So we got into a whole discussion about why do veneers pop off? These are the things that can happen to them. They can just completely fall off your teeth, right?
But why would they do that?
Well, okay. So they can fall off.
Yes.
They can break.
Yes.
Right? They
Like
can
the
just
corner
chip.
of it.
Yeah. Or you can get like a cavity around them.
Okay. Or they like turn dark around the edges.
Or they turn dark around the edges. Or your gums can get swollen.
Oh yeah, that's a huge problem where the gums are like constantly bleeding around them, and you're just like always puffy gums and bleeding around your veneers.
Totally. So that's a big issue.
Yeah.
And then sensitivity, like it can cause pain to your actual teeth, right?
Right.
It can cause issues with the nerves of your teeth.
Yes.
So all of these have to do with lack of planning, the design of the veneers, and your bite.
Yes.
So,
when they pop off, I think that's the biggest fear that people have with veneers.
Yes.
That they're just gonna pop off, and that's like super embarrassing, super, inconvenient, obviously. So, why is that? Like, let's talk about that one first.
So there's a couple of reasons why a veneer can pop off.
Yeah.
First is the design of the preparation, like how the tooth was prepared. So our teeth have different layers of material naturally. The inside layer is called dentin, the outside layer is enamel.
Right.
When you are sort of sticking a veneer, which is made out of porcelain, onto your tooth, you are bonding it. So there's a special chemical fusion, and there's some mechanical retention, but mostly it attaches based on
It's
that.
like glued on, basically.
It's glued on chemically, yeah.
Right.
And it does much better when it's glued onto enamel versus dentin.
Right.
And so if your dentist has over-prepared your tooth, which is taken off too much material on the surface of your tooth, where most of the tooth is now dentin on the surface,
Right.
then your veneer is much more likely to pop off because it doesn't have as strong of a bond to the dentin on your tooth.
Right.
Plus, now you've lost some of the structural strength of your tooth, so your tooth tends to bend more.
Yeah, we've talked about this before, that outer layer is like the hard layer, and then the inner layer is softer, so it has more flex. So if you're like gluing something onto a layer that's moving underneath it, so something hard and then something that's moving, well, it's gonna pop off.
Exactly. So as you bite and you press forward on your teeth and bite into something and try to bite into an apple, your tooth will flex, and this stiff veneer on the surface will just pop right off.
Right.
And so that's a major reason. Over preparation of teeth is a huge problem.
Right.
Which can, by the way, also lead to sensitivity on your teeth, more likely for your teeth to crack. And then what happens with that, when those veneers pop up, I can never put that enamel back. So now I have to figure out how to bond this thing on, and it usually ends up meaning having to prepare your tooth more to create more mechanical retention.
Right.
Because veneers, in the classical sense, just sit on the surface of your tooth, so they really don't have a lot of mechanical retention.
Well, let's talk about what that is. So mechanical retention is when two things lock in together.
Sure, yeah.
And they hold, and it kind of like sits there, but because it's locked in.
Yes.
Chemical retention is when it's glued on, but it's not really locked in. It's just that glue layer or that bond that's
And
holding
it's the
it there.
force of that. the strength of that
The
glue.
strength of that glue is what's holding it on.
Yes.
So veneers traditionally have been placed with chemical retention, so just based on the strength of the glue. But now if it starts to fail and fail and fail, we have to find ways to actually lock it on.
If it's failing because of over preparation, so you
Right.
don't have the strength of the chemical glue
Yes.
bonded together, then you have to create mechanical retention to get it to stay, which usually means preparing kind of the backside of the tooth so that this thing has like more surfaces basically to hang on
Right.
to your tooth with.
It's like kind of connecting on the front and the back, so it becomes more of a
More
crown.
of a crown,
Yeah.
or clamshell
And
style or
but
something.
you know, like those people who do fly out and get a full set of veneers and fly back in are way more likely to have this problem. Why? Because the dentist is forced to go over prepare, because the teeth can be in all orientations, and we've talked about this in other episodes about having the teeth in the right position to begin with, so then you're
Yes.
not having to cut into it so much to make it look straight.
So they're literally cutting corners by cutting the corners of your
They're
teeth.
literally cutting the corners of your teeth
You
and
know.
going into that softer layer because the teeth are not in the right position. So they have to make it look as if it's all straight.
Totally, and it requires less thought because they don't have to be like, oh, okay, what angles do I need to prepare to make room for the porcelain but not overcut the teeth?
Right.
Which is what we do. We really plan this thing out, plan from the end in sight.
Right.
Like this is what we want to end up with. What do we have to remove to get that? What's the minimum amount we have to remove to get there? And so when you fly out of town, they haven't made these plans. They're just like, we're gonna like cut them all into little pegs. Then we can do whatever design that'll fit on top.
Exactly.
So it's easier for the lab to just kind of stack a bunch of porcelain on top of smaller teeth versus try to kind of maneuver around your teeth how they are or
Right.
with minimal preparation. So huge problem.
So that's really the reason why they just pop off altogether.
Over preparation, and then secondly, the technique and bonding. So when you're bonding something onto the tooth, like a veneer, you have to take some very specific steps. Use higher quality bonding materials. It really makes a difference.
Right.
There's gold standards in dentistry that have had a lot of research behind them, but they take more time because they take steps, and you have to take these steps and be super meticulous about how you do it.
Right.
So if you're bonding something on with a lower than gold standard bonding agent, okay?
Yes. Or
Uh,
it's not about that. It's just like every step adds complexity. So you have to be really meticulous about doing each step.
Yes. You have to
And
be-
so there's other materials that are like, okay, we're just going to combine these 3 steps into this one step. But that's not as strong as if you had done it in three
separate
steps.
steps,
But
yes.
it saves you time.
It saves you time,
Yeah.
and so the dental manufacturing reps are told to push these materials. So they go
Yeah.
into practices and they're like, "We got this new stuff. It's really great." Well, most dentists are not doing the research to find out, is this really a
We're
high
constantly
quality?
getting bombarded by ads from different manufacturers, and it's really hard to navigate sometimes as to what is like the right thing to do and what's the best thing. So it takes some time and effort to like really understand these materials and to choose the best one, and then also choose to do all those extra steps. So that's a lot that goes into it.
It is a lot.
Yeah.
It is a lot, but so you want to find someone who's dedicated to this. I mean, we have taken extra education. We teach at UCLA. We have gazillions of study clubs, and we go to conferences, right? We're constantly like looking at, best techniques, best materials, to maximize this.
Right.
And from a selfish standpoint, I don't want my veneers to pop off on
Right.
anybody. I don't want that headache. And of course, I want to make sure I provide good quality for my patients.
Right,
But
right.
it makes me sleep better at night as well, knowing.
Yeah, of course.
So, but those are the things that add cost as well. So anyways, that's the second thing, so having it over prepared, not having the bond strength there, right?
Right.
Causes sensitivity as well. And then the other thing that leads into like, if they don't use a good technique, if your gums are like swollen, if you have gingivitis and your gums are bleeding as they're trying to like bond these things in, and blood gets in between layers of the veneer.
Yes, in that bond layer.
In that bond layer,
it's not going to bond.
They're more likely to pop off. They won't pop off right away, but they'll
Right.
pop off in like 6 months or
Yes.
something like that, or a few months. And then over the years, you'll start to see like a little black line around your veneer.
Yes.
And often that's because some blood, some stuff got under there. And
Yes.
so the veneer starts to kind of go dark around the
Around the
line.
corners.
Yeah, so that's another thing.
So let's talk about why they chip. Why would they chip though?
So yeah, so then the next thing is chipping. So chipping often has to do with your bite.
Okay.
So if you want to get veneers and you want to veneer your front 4 teeth and you want to make them longer, you need to give support to the back teeth to support that. So the back teeth are there when we chew. We want our back teeth to touch and not our front teeth.
Right.
When we grind our teeth side to side like this, again, we don't want our front teeth to touch. We want our lower front teeth to kind of slide past our upper front teeth. And if you make your veneers too long and you don't put support, like you don't also lengthen your canines, for example.
Right.
Our canines are our eye teeth right here. When we slide to the side, our lower jaw rides against that canine. Our canines are like barrel shaped. They're like a ramp. So
Yes.
our jaw ramps over that, and so you avoid banging into the corners of your upper front teeth.
Right.
So if you're adding length to your front 4 teeth, and it's because you've ground down all of your teeth, or all of your teeth are short for some reason,
Right.
then you also need to add to your canines.
Yes. So if you are someone who is getting veneers because you've been grinding and your teeth are really short, please do not only just add 4 veneers to your front teeth. For sure, they're gonna chip or pop off.
Right.
Because you need that back support. Like,
Yeah.
you can't just have 4 big teeth and then have all the rest of your teeth ground down. You need to like open up the whole thing together and give support for those front teeth to be able to be longer.
Also, it'll look pretty bad if you just do 4 front teeth.
Yeah,
It usually doesn't
but
look
I've
good.
seen stuff like this
Totally.
where it's like they just add to a couple of front teeth and it's constantly chipping and breaking, constantly chipping and breaking. And it's like, well, how do you expect this to work? Like, everything else is ground down and you're just trying to add to like these few teeth. It's not gonna work.
Yeah. So the other reason why front teeth can chip is if you have crowding on your lower teeth. So when we protrude our jaw and go like this, go forward and back, our lower teeth slide against the inside of our upper front teeth. Now imagine if you have one lower front tooth that's forward and crooked. So you got this one point.
Right.
And when you slide forward, it's that one point that's hitting against this like new veneer or bonding or whatever it is that you had done on your front tooth on the top.
And that was the reason you had it done, because that area was chipped or broken or something. So now you added to it, but you didn't fix the reason why it was chipped or broken.
Totally. So the other reason why we often are going no veneers until you do some Invisalign or orthodontics
Right.
first and align your teeth.
Right.
Because this is the reason it's happening. It doesn't matter what I do to your top teeth. This is going to keep happening to you. It's going to keep
Exactly.
breaking. And then thirdly on that note is if your teeth are straight, you straighten them, you definitely want to wear retainers on top of your veneers and also on the lower arch for the same reason. So in years down the line, if your lower teeth start to crowd, now you could be creating a problem that you didn't used to have. I've had patients who've come in and said, you know, I had this bonding done since I was a kid and it was fine, and now it chips every like 2 years. Why
Right.
is that? This
Right.
dentist that's been doing it for me sucks. And I'm like, well, probably your lower teeth have shifted over the years, and
Right.
now it's causing this impact that you didn't used to have as a kid when your teeth were straight or whatever.
Right,
you know?
right.
So,
Things move and shift around in
Right.
the mouth just like everywhere else in the body.
yeah, so you need to protect that.
Yes.
So failures, gum disease, crooked teeth, bite not being correct, over-reduction of your teeth by
Over-reduction
your
of
dentist.
the teeth, not
So-
taking the time to go through all the steps of bonding,
Yes, yeah. So
and not
protect-
isolating cleanly while bonding so blood gets under there.
Totally, yeah.
Yeah.
Those are the reasons why veneers can fail, basically. So if you, and we get a lot of patients who have like messed up teeth in the back, all their teeth are falling off, big holes, missing some, and they're like,
Yes.
I just want you to fix the front 6 and make me look good.
Yes.
And I'm like, well, you don't get that till we get some back teeth.
Yeah. On that note, that's the same thing with missing front teeth too. Like missing a bunch of back teeth and missing a front tooth. All I want to do is fix this front tooth But I mean, things need support. It's not like a one tooth by tooth system. The whole thing has to function together.
Yeah, it's sad, and I understand that, and I always have these conversations. If someone comes in and they're missing a front tooth, and it's really affecting their self-esteem or how they're functioning. Yes, I want to correct that for them, but they have to know, they have to understand, this in the front alone is not stable. They need back teeth to chew with,
right?
And we need to proceed. So sometimes I'll fix one little front thing just to kind of
make it look good, but it's not stable.
But it's not stable, and they need to come and correct the rest. And sometimes they do, and sometimes we don't see them again until this thing breaks
again,
because they didn't listen and fix their back teeth.
Yes.
So unfortunately, we can't fix all these problems.
I feel bad because I feel like there's a lot of perception out there that as dentists we're trying to like sell all this treatment or whatever. And really, like, we want to do the right thing. Like, we want to do the right thing. Want to give you a smile and a mouth that's going to last. And it does require the whole system to be functional and functioning. Especially if you're getting cosmetic work done. It makes no sense to get cosmetic work without putting, teeth behind it, like bite and opening up your bite and giving you all these wraps and things that are going to protect this beautiful cosmetic work.
It's all the difference. And on the note of not selling, I had a patient yesterday in the chair. He's been our long-time patient, and he saw our associate yesterday. And he came in because his bite is messed up, and he was having some pain somewhere.
Yeah.
And she's like, well, I think you would be a good candidate for clear aligners or Invisalign. And he said, oh, yeah. Every time I come in, they tell me that.
Right.
I know you guys are the top 1% providers of Invisalign.
Right.
You guys really push that. And I was listening. I wasn't in the room, but I was in. And then she came back and she said that. I'm like, well, we tell him to do Invisalign every time because that's what he needs. Because his bite's this way. And he comes in and says, my bite's messed up.
I know.
And then, so, yeah, sometimes it feels that at least we're consistent.
I mean,
I don't know.
Unfortunately, the human body, fortunately or unfortunately, eventually shows you, right? Like you can get away with stuff maybe when you're younger or whatever, but over the years, these things do, become worse. They do get exacerbated, like periodontal disease, bite issues, TMJ issues. So all this stuff, eventually, like if you just are missing teeth, and then focusing on just the front teeth, over the years, maybe like in your 20s you're fine, then 30s you're fine, and then by your 40s and 50s, things really start to deteriorate fast.
Yeah.
And it's just about having that whole system working together, and that's what we try to focus on.
Yeah, it's so important. I have that conversation with young people all the time who come in, or people in their mid-20s. They're like, oh, I'm finally ready to, I got insurance, I'm ready. And I'm like, you're here at the best time. They're starting to get a bunch of cavities.
Yes.
They're starting to have some issues. I'm like, we fix this now, it's going to be like a good dentition for your future. If we don't, you're at the precipice of this turning back for you.
I'm losing one tooth, I'm losing another tooth, this one's hurting, just take it out. And then it just becomes like anyway, these are what our dental fears and thoughts.
So why your veneers can fail has a lot to do with lack of planning and thought by your dentist, over preparation of your teeth, preparing your teeth for veneers when you have gum disease, not having good technique, and not correcting your bite. These are the same issues every time. This is why veneers have a bad reputation sometimes that they pop off. But if all of those things are taken care of, they can be a very reliable thing to do, and they can last you for many, many years.
Yeah, decades. Mm-hmm. Okay, well, come visit us at LA Dental Clinic. We do free virtual consultations, and we hope to see you soon.
Bye.
Thank you for listening to the Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.